I find gastroenterology a remarkably rewarding specialty, really because it is so complex and it involves so many different parts of the body. Unless our gastrointestinal tract functions properly, it is likely to compromise not just our digestive health, but the health of the rest of the body, both our physical and mental health.
Nearly everyone has heartburn once in a while, but if your heartburn happens 2 or more times a week, it may be a symptom of something more serious. You may have gastroesophageal reflux disease, or GERD.
GERD is something that occurs when stomach contents reflux back up into the esophagus. The disease part of this occurs when the reflux, the stomach contents coming into the esophagus, cause symptoms which are troublesome and/or injury to the esophagus, what we call reflux esophagitis. Generally, heartburn is described as a burning sensation behind the breastbone. It may go down lower to the top part of the abdomen, and often it feels as though there's a burning sensation that comes up behind the breastbone, sometimes even to the back of the throat. Regurgitation is actually the feeling that liquid or food has come up into the back of the throat. So it's the physical feeling that something has come from the stomach or the esophagus all the way up to the back of the throat.
GERD impacts quality of life. Patients experience impairment in vitality, feel low in terms of health, pain, and emotional distress, and are more limited in physical and social activities.
And so one of the most troublesome issues is when they get heartburn or regurgitation at nighttime that wakes them from their sleep, or can even make them feel as though they're choking because they've had regurgitation with stomach contents coming back up into the back of the throat.
For mild GERD sufferers with infrequent symptoms of reflux, simple dietary and lifestyle changes may be enough to provide some relief.
Sometimes it may be particular foods, so eating a larger meal or a meal that is more difficult to digest, things that contain fats or chocolates that are difficult to digest are likely to keep contents in the stomach for a longer period of time, trigger acid, and therefore trigger reflux.
GERD is not just a lifestyle issue. Up to 15% of adult GERD patients will develop Barrett's esophagus, a condition in which the lining of the esophagus becomes damaged by acid reflux, the primary risk factor for developing esophageal cancer. It's important to be diagnosed and treated.
And there are a variety of different classes of medications. Antacids work by neutralizing acid so that it doesn't cause as much in the way of symptoms. There are medications like Gaviscon that include what are called alginates that form a raft at the top of the stomach that reduces the amount of reflux that goes into the esophagus. There are acid suppression agents like the H2 blockers, famotidine and ranitidine, that reduce acid secretion, and then more effective acid suppression agents like the proton pump inhibitors. There is also a class of medications that coats the bottom end of the esophagus and coats the lining of the esophagus so that when reflux occurs, it's less likely to cause symptoms and less likely to cause injury. And these are medications that are called mucosal protectant. There are a number of these now coming onto the market. Mucosal protectants differ from antacids in the way that they work. So antacids neutralize acid, either in the stomach or in the esophagus, whereas the mucosal protectants include compounds that bind together but also bind or stick to the lining of the esophagus and therefore form a protective coating so that any acid or pepsin or digestive enzymes that comes into the esophagus is less able to reach the lining of the esophagus and cause injury and cause symptoms.
One example of a mucosal protectant is ESOF, an innovative oral therapy for stomach acid-induced heartburn. The combination of hyaluronic acid and chondroitin sulfate ingredients in ESOF work together to form a physical barrier in the esophagus, which limits contact with the refluxed acid and promotes wound repair.
I think there are a number of key messages around gastroesophageal reflux disease. One is that it's very common. So if you have typical symptoms, if you're getting heartburn or discomfort behind the breastbone, and particularly if it seems to be triggered by foods or by bending, you're not alone. There are millions of other Canadians who have similar symptoms, and it's important to know that there are very effective treatments available with a range of different treatment types that can be tailored so that you can deal with your reflux disease and get on and enjoy the rest of your life without worrying about it.
For patients experiencing symptoms, always consult your healthcare provider for proper diagnosis. If heartburn becomes more frequent, won't go away, or stops responding to over-the-counter medications, it may be a sign of a more serious condition that should be addressed by your doctor.